There's a new Medicare idea being discussed in Washington. What if seniors were no longer defaulted into original Medicare, but instead were automatically placed into a Medicare Advantage plan, or what's called an ACO? Supporters are calling it coordinated care. Critics are calling it a quiet takeover of original Medicare. We're going to be talking about that on today's show. This is very important. I hope that you pay attention. We are so happy to have you here today. The show is brought to you by MedicareSchool.com. I'm here with my dad, Marvin Music, in the studio today, and we're just so excited to be with you explaining Medicare so that you don't make a mistake and you get the coverage that is right for you. Guys, outside these studio doors, we have about 100 people that come to work every single day wanting to help you explore your coverage. So if you need help with Medicare, whether that's enrolling in a supplement plan, an advantage plan, a drug plan, a dental plan, whatever the type of insurance is, we are here to help you. You're in the right place. The phone number to reach someone at our company is 800-782-6676. We're right here in the heart of America, Kansas City, Missouri, and we are just here to serve you. The great thing about working with MedicareSchool.com is when you become a client, you are given a dedicated client care manager, somebody that you can talk to anytime about your situation. So if you lose your ID cards, if you have a billing issue, a claims issue, if you move across town or across the country and need new coverage in place, we can help you. You are not going to be transferred to some call center on the other side of the world with someone who doesn't know English. So we'd love to work with you. It's free to work with us. And so give us a call, 800-782-6676. If at any point you want to be a part of the show today, whether you have a Medicare question or a Social Security question, retirement question, maybe you have an experience that you think would be helpful to our listeners, we'd love to hear from you. It helps all of us get better. This is your opportunity to talk to my dad, Marvin Music, truly the nation's leading educator in a non-sales environment. We're not going to try to sell you anything. We're going to listen. We're going to answer your questions to the best of our ability. We've helped millions of people over the last 15 years, and we would love to help you. So there's a new Medicare idea being discussed in Washington. What if seniors were no longer defaulted into original Medicare, but instead brought to be placed into a Medicare Advantage plan or an ACO? Supporters call it coordinated care. Critics call it the quiet takeover of Medicare choice. So we're going to be talking about what an ACO, what Medicare, about all this rule of Medicare or people being forced into these plans.
All right. So what's in the news right now is a comment by one of the leaders in the CMS as they were discussing the possibility of doing what is called default enrollments. Okay. So when people enroll into Medicare A and B, we know, and many people know, that they have some options. They can do A and B and they can get a supplemental plan, or they can enroll into an advantage plan. But what happens is some people decide to do nothing. Okay, they're not sure what to do. Maybe they're afraid to making the wrong decision, so they simply stay in just original A and B, which of course is the fee-for-service plan. And so what happens when people stay in A and B, no one is helping manage that care. They know that many people in that don't even go to the doctor because they're afraid, what's going to happen financially. Sure. And so the government's concerned about this. They would like to have some kind of coordination of care for these people to help them, to make sure they're doing their preventive visits and they're, getting their medications, all the things that they need. And so the government is moving more and more towards, they want people being coordinated care plans. And so to facilitate this need to make sure people get care, they're proposing that either they would enroll them into a Medicare Advantage plan or into an ACO plan. And ACO stands for Accountable Care Organizations.
This would happen automatically.
Well, automatically,
okay.
Exactly right. Okay, and so meaning they didn't make a choice. Now that doesn't mean to say that no one would have a choice. It just means those that just enrolled in A and B would be required to be in something. If they didn't opt in one of the programs, then now they're going to be automatically enrolled. Okay, so the biggest issue and really the fear is, well, who's going to decide that? Because one size doesn't fit all. And so what happens is if they were to automatically enroll people into advantage plans, there's going to be some issues there. Who's going to make sure that the person's doctor's in network, the hospital's in network? Who's going to check to make sure they would know exactly what the max out of pocket is going to be and the pre-authorizations and how that system's going to work? who will decide that? Well, the government's not going to do that. So what will probably happen? They would kind of do a round robin. So this person
goes into that plan.
That's exactly right. We've seen this happen before with drug plans and on Medicaid. So the point is that's scary. Because no one's going to take the time to really see if that's a good fit for the people. And then what would happen? Well, most of those people, they were enrolled in a plan. They think that's their option. They stay in it. And if they stay in that Medicare Advantage plan for now more than a year, now they're stuck on that plan possibly for the rest of their life, because if their health changes, they can't get off of it.
Yeah.
So that's a little,
and go into a supplement.
Exactly. Yeah, that's a little troublesome. So not only are they giving up choices, they're also could have a lifetime
Long-term
impact.
Flexibility.
Yeah, and that's why they're going to get a lot of pushback on this idea as far as enrolling into Medicare Advantage plans. Now, the other option would be ACO. Totally different system.
What is that?
Accountable Care Organization. Let me just give you a great definition of this, really, for you and everyone.
Okay.
An accountable care organization is a group of doctors, hospitals, and other providers who work together to manage your care under Medicare. So the way to look at it is this is someone that enrolls in original Medicare A and B, and the ACO is a layer above that.
Is this like a hospital network or a hospital system? Or is this?
It is.
Who's paying these people?
Okay, Medicare. This is still the original Medicare system. The payment system doesn't change. And so what happens, though, is these doctors and hospitals, and I'm going to read a couple to you here in just a minute, that they group together, and now what they're going to do is manage the person's care. And I'll tell you why they do it. But they're going to manage the care. So we have two now managed care options, Medicare Advantage, and now we have ACOs. And so, but what happens with the Medicare Advantage is they manage that care. What are they trying to do? Make a profit. They're trying to, at sometimes, impose restrictions upon people. So there are limitations by networks and pre-authorizations where that managed care many times may not be in the best interest of the client. And so we see doctors and hospitals that say, there's a better way. Let us do that. Let us manage that care within original Medicare. And so they have put together these large, huge groups of doctors and hospitals that now will manage the care versus the private health insurance company. So it's still that Medicare A and B system. Now, here's the thing. Financially, if someone is going to a provider that's in an ACO, they don't really get any benefit from that. Okay. Who gets the benefit would be Medicare as well as the providers. Because here's the way it works. Let me just give you a quick example. Let's say that Medicare says that typical service or that typical health condition with the surgery and all that's involved may cost us $10,000. So what the ACO will do is say, hey, we'll provide that service for $8,500, and the difference we'll split it. So
who's we?
The ACO, this group, and Medicare.
Okay.
Yeah. So what I'm saying to you that they're going to manage the care at a better price, and they're accountable to that because Medicare says, okay, we're going to give you $8,500 because you said you could do it for that. We have typically been paying $10,000 for that. We'll pay $8,500, and we'll split the difference. Okay. And so now there's $1,500. Medicare saves $750, and the group made an additional $750. Okay. And so here's the point, Josh. Now, we don't have numbers on 2025 yet, but in 2024, there was like $2.5 billion that Medicare saved through these ACO type of arrangements. Okay. What I like about it is because we know with Advantage plans, there's restrictions, networks, pre-authorizations, one-year plans. This is still original Medicare, so they still have the freedom to go to any doctor that they want to. Now, is every doctor part of an ACO group? No. For sure not. But these are beginning to grow and grow. So they're having a huge, right now there's 14 million people that go to an ACO doc or going to ACO. Do they even know it? And they don't even know it. They don't know. And again, it's not like they're picking out the plan. They picked out the provider who has chosen to be a part of one of these organizations.
And what's the advantage to the provider?
The provider is they have a little bit more quality care because the primary care doctor is coordinating with the specialists who's coordinating with the hospitals and the surgeons. Okay. So they all get to kind of collectively manage this care together. Okay. So that's their advantage. And if they do it at a better dollar, then they're going to get some of that profit. And so here's the whole point. The gripe that people have about fee for service is no one is managing the care. The patient has to do it on their own. If I have a problem, what do I have to do? I call my primary care doctor. He refers me to a different specialist. And so there's a lot of movement. This brings it all, that care underneath it, of the umbrella still of original Medicare. But now these docs can coordinate together. And it's working. They're collaborating. And it truly is successful. It is.
Yeah. I want to learn more about that.
And I do as well. But let me just share this real quick, and I'll close that. I think this is important. So what happens with the ACO model is the providers get this target spending amount. So they say $8,500, and then if again they do it better, then they're going to get to make additional money. I like that. But let me list a couple off, and then we'll close out. Okay. So here's some of the larger groups. Get this. There's one called Trinity Health Integrated Care. It's an ACO, Josh, 130,000 members on Medicare. There's one in Texas, huge, Baylor Scott and White Quality Alliance. Another one called Mass General Brigham ACO, 130,000 Medicare lives. Advocate Physician Partners out of Chicago, huge group. Caravan Health, 250,000 people. Palm Beach Accountable Care. Privia Quality Network, Home Health, Health
So there's
Connect.
people that, if you may be listening to this show, you may be a part of it and they don't even know.
Yeah, they probably don't know because it really doesn't affect them as far as their pocketbook. Their Med Sub still pays the same. They're still paying everything the same. So they really don't save anything, but I think it is an opportunity for them to probably get better quality care than just a regular fee-for-service doctor. So I'm almost done. Listen to this. Mercy Health, of course, here in Missouri and Kansas, huge in this area. Here's another one, Banner Health, 400,000 Medicare lives. Another one out of the East Coast, New York City Health and Hospitals. So the point is huge groups. So again, about 14 million people on Medicare right now that are covered by or seeing a provider that's a part of these groups.
So in your opinion, when we talk about getting auto enrolled in something, it seems like, we're talking about auto enrolling in Advantage plans. And you're saying that's probably not going to happen, at least anytime soon, which I think there was a deputy general or something of CMS that said, we're not planning on that. But ACO is another model for essentially helping these people that just have Medicare A and B. And so if you're listening to this, you've got Medicare A and B only, right? Nothing else.
Well,
or maybe you even have a supplement plan.
Right.
Being a part of some sort of an ACO could help you have better care.
And so, you could ask your doctor. They may already be a part of one, or if you're looking for a doc, maybe find what it is. Again, you're not going to save any money, but what Medicare is trying to do, and so eventually this will probably happen. But it could be 5-10 years down the road. But they want value-based care. They don't want it just to be, order this test, that test. But can we improve the health of the patient and do it at a better price? And as I look at this, I'm much more excited about ACO than whether it be the Advantage because we get to stay in original Medicare, and I think that's a great option.
Let's get to our first caller. We've got Fred calling in from Texas. Fred, can you hear me?
Yes.
Hey, what's your question, sir?
Yeah, I got a couple questions here. I guess we'll start with one of them's about Medicare. I'm still on my work insurance. I have all my accounts set up. I went with y'all's agent called Jesse Fox.
Jesse's a wonderful guy.
Yes. Yep, I know that. We spent about an hour and a half setting this up. So he took his time with me, and I was very pleased with his service.
Did he tell you about his side? Did he tell you about his side business? He makes custom fishing lures. They're like $100 a piece. Yeah, he's a fisherman with a great epic beard, but I didn't know if he told people about that or not.
No, he did not.
Interesting guy. Okay, go ahead with your questions.
Yeah. Okay, my first question is, I went for my 6-month checkup, which it still got billed through my employer insurance because I'm still employed. And I told her my next visit in 6 months I would be on Medicare with a Medigap plan. And she said, well, when you call in, make sure you set this up as a physical. Does Medicare pay for physicals?
Yeah. Well, first off, I wouldn't use that initial terminology. I would say would like to have what is called the Welcome to Medicare physical. Okay, because Medicare doesn't pay for a full-blown physical that you would be accustomed to receiving on your employer plan. They're going to cover you, but it's not the same. So it's not apples to apples for sure. So just tell them you want your Welcome to Medicare physical. They're not going to draw. They're not going to draw blood.
Welcome to Medicare physical or Welcome to Medicare visit?
Yeah, either one. They call the ones after the first 12 months
annual wellness or something.
Annual wellness visit. So it's a visit, but it's not really a physical, but it is the Welcome to Medicare. You get to do that within 12 months of your B date. And so what will happen is it's really just a review of your present situation. They're going to do height and weight and body mass and check your blood pressure. And, they're going to do a few things, but I promise you they're not going to draw blood. It's not going to be a full-blown physical that you've been accustomed to. Now, if doc sees something or is concerned about something, then they'll just set up another appointment and dive into other issues. But that first visit, Medicare only covers the things that are very specific to that visit.
Okay. Or I just can tell her I just wanted my 6-month checkup when I make my appointment and just skip the physical part.
Yeah, well, I wouldn't say that. I mean, I just would not, because you're going, if you're going to be on Medicare during that time, you want to say, I want to set appointment up for my Welcome to Medicare visit or Welcome to Medicare physical. Okay. The key is Welcome to Medicare. And the reason I'm saying that, Fred, is because once your B date has started, you have this 12-month opportunity to have this particular visit. And then after 12 months, you can't get that one. You can get annual wellness checkups, but not this one. So I wouldn't say physical. Okay. Unless you want to say Welcome to Medicare physical. Enough of that.
Yeah. If you get, do you have a plan G?
Yes.
Yeah. So if you do something other than that, in the beginning, you will be billed, right, for if it's outside of the scope of the annual or the Welcome to Medicare
separate
visit.
Appointment though, Josh.
Yeah.
It's going to have to be
separate appointment. You're going to be billed. You're going to have to pay your deductible, which is $283. Right. So it's just not your 6-month deal is just going to be different.
Yeah. If doc says he's concerned or she's concerned about something, then they're just going to set up another appointment for you to go through some kind of evaluation.
And you have to pay for
diagnostic work. Exactly.
Your portion of it.
Yeah.
Okay. So it sounds like I need to make 2 appointments because every 6 months they want to take my blood always to check, for cholesterols and all that good stuff.
Mm-hmm. Yeah, that's fine. And so what's going to happen though with Medicare, if they pay for that blood work, it has to be medically necessary. They're not going to do it just as some form of preventive measure like your group plan has been doing. It's totally different, Fred. It just is. It has to be medically necessary for them to cover those type of things. That's why I'm saying you have this, you want to welcome Medicare physical. So then if doc says, hey, we need to check your blood every 6 months, then they're going to code that differently as medically necessary. It's not preventive. It's not a physical.
And you're probably not the only Medicare Welcome to Medicare visit that this doctor's ever done. So he should understand and know that.
Right.
But you do have to give him a little bit of direction.
Yeah, but I've said for years, when you go to this visit, you don't go in there and tell the doc what you want. Doc, I want this, I want this, I want this. You say, doc, I just want whatever Medicare is going to pay for that's included in this initial visit. That's what you want to do.
Yeah.
Hey, I've had plenty of people in my career that have gone in and told doc what they wanted during that physical, and they end up getting a bill for $400 or $500. Why? Because Medicare doesn't cover everything you want. They're going to cover things that they're going to specifically say is covered by that visit.
Okay. So then after I make this appointment here and go down the road, like every 6 months, he wants to check on your blood and all that. He's going to have to code it different.
That's
for
correct.
them to pay it.
Exactly right. And I trust me, I believe they're going to they know how to do that. They want to get paid.
Mm-hmm.
Okay.
Yeah. Oh yeah. Okay. All right. I got that down. And as for medical, physical, welcome. Welcome to Medicare or whatever.
Welcome to Medicare.
Okay. Yeah. Okay. Now my other questions are to deal with the Part D plan, which I have not set up yet. I'm going to do that next month because Jesse told me don't do it too early because they start you the next month whenever you sign in. So I will be going because I have my company. My company covers me all the way till May 31st. So I'll be going on Part D June 1st.
Good.
So my question is. We set that up, and he sent me like a video how to set that up on Medicare.gov, the drug plan,
yes, sir,
and all that stuff. And it's got all my drugs listed. So when I went yesterday to my primary doctor, he changed one of my drugs and switched it out to something else. Do I need to get with Jesse to redo that thing he sent me to the house?
What's the medication that was added?
Oh, let me go get it.
Because if it's just a generic,
I know it's for indigestion. It starts with I know it's like
omeprazole?
FAT, something like 40 milligram.
Omeprazole, 40 milligram. Okay, yeah, that's not going to change anything. Like, it's not an expensive brand. That's covered by, I would assume, every single plan that's out there.
Yeah.
So yeah.
Okay.
Don't worry about that. If you said some expensive brand name medication like Eliquis or something, then I would tell you something different. But omeprazole, you'll be fine.
Okay. All right. That'll work there. And then my other question is, my wife has a few issues. We all signed up together with Jesse Fox, and we're going through the role with the Part D coming up like in June 1st, like I said. Say if she has a doctor, and he has some high dollar drugs, because we decided on a premium for like $108 for her now. And let's say the doctor keeps her on those drugs, and then let's say like Eliquis, that's one of the drugs she takes.
Yep.
Say 3 months down the road, he says, you know what, we no longer need to be on this drug.
Sure.
So we will not be no longer. Will your monthly premium adjust since you're off a high dollar drug?
Yeah, no. So the way that's going to work is every year from October 15th through December the 7th, you have the opportunity. You have the opportunity to change your prescription drug plan. So the plan that you enroll in, that's going to start June 1st, that's going to be her plan for the rest of the year, right? But in October, and it's really easy to do. Go back into Medicare.gov, put in your zip code, put in your medications, choose your pharmacy, and then it will tell you what the right plan is for you, right? The plan that loads up at the very top, this is the plan you need to be on. If that's different than the plan that you're on currently, you click enroll, and 5 minutes later, you're done. It's a very simple process.
Yeah, and we'll reach out to you, Fred, to remind you about this. Yeah, we reach out, and we give you instructions and kind of hold your hand through that process. We do a daily, actually drug plan only live stream where you can tell us your meds, and we'll tell you what plan to go on, that sort of a thing. But they've made that process pretty simple now. And so, but it's not going to change middle of the year. You're going to change it from October 15th to December the 7th with your new coverage starting January 1st. Now, Fred, is that that 108 that you mentioned, is that your Part D premium?
Yes.
Okay.
I think if I remember right, it's going to be Humana, I think.
Humana? Okay, very good. Okay.
Yeah.
That's great.
Yeah, she takes another one, Abrola or something like this for migraine headaches. That's another high dollar drug. Yeah. That's why her premium's way up there.
Yes. Yeah. Well, it's smart to have a high premium if your meds are covered, and then she'll probably, she could possibly max out. So that sounds good. We see the plan. It's called Humana Premier. So the good formulary, good plan. Does it have a deductible on it this year?
No.
Okay. Zero deductible
and
as
then
well. Good.
Yeah. On that max out thing, which could possibly, it won't happen this year, I don't think, because we just got 6 months left there. But like next year, you know how you have that, you could do that op thing where you take that $2,100 or whatever, divide by 12, and that's what you pay monthly.
Yep.
Do I set that up through Medigov, or do I get with Jesse to help me out with that?
No, you actually set that directly up with the insurance company. So
right with Humana.
If Humana is still the best for you for 2027, you'll enroll in that in the first of the year. And they'll take that. Now listen, it'll probably be maybe $2,200 next year. I don't know what it'll be. They usually raise it a little bit. It's just called a Medicare prescription savings program. Medicare prescription savings program. You'll enroll in that with the insurance carrier, and that's what they'll do. They'll take it and divide it out over 12 months, so you don't have to come up with that deductible or a large amount just initially. Okay, good program.
Okay. Yep. And then, if I understand that program right, 'cause I've been reading a little bit about it, you pay, say I'm going to throw a number out there, $167 or whatever. I think that's what it comes out if you take that amount and divide by 12, 167 something. When you pay that, you're going to pay that always to the insurance company. So when you go to a pharmacy, you're going to pay zero for all your drugs, correct?
That is correct. Yeah, the plan will actually bill you for that. And by the way, just so you know, it's not going to be $2,100 divided by 12. It doesn't work that way. Okay, it will not. What will happen is it's going to be close to that, but it's never, because they recalculate that amount every month. It'll just not be any more than $2,100.
The insurance company sends you a bill for that?
Oh, yeah.
That's
And they do not pay at the pharmacy.
Okay.
Yeah, the insurance company will cover all that, and then they bill them.
Okay.
Yeah.
Interesting.
All right.
Okay.
So, yeah, cool. And a good program, especially if you know you're going to meet the 2100. And some people that would say, hey, I have the 2100 in my bank account, I'll go ahead and get it out of the way. Then they don't have to worry about it. There's be zero, the rest of the year. But if you want to spread it out, no problem at all. That's what it's there for.
Okay. And then the last question, say when you get, how do I get to see what drugs that Humana carries that you don't take? Like, you go to a doctor and say, hey, we're going to put you on something different.
Yeah, they should have an online formulary that you can access through the Humana's website. And then another thing you can do is, I know you can get the formulary for sure, but if you didn't, you can always go to Medicare.gov and put that medication in and see if it's covered by that plan. So 2 ways you do that. But again,
the key word is called a formulary, and that's kind of a hard word. Formulary is just a list of medications that the prescription drug plan covers. So it's called a formulary.
Yeah.
All right, Fred, is that everything for today, sir?
That is it. And like I said, I want to say, keep up your videos. They're very helpful. I've been watching you for 2 years now.
Wow, that's great. Well, listen, it's our privilege to serve you.
Yeah, this Medicaid and Social Security thing, that's a process, let me tell you.
It is. There's a lot to it.
And yes, and you really can get screwed over if you're not doing the right thing.
Yeah, you're right. Well, you made some good choices. Number one, you went with a great plan. We love the G and still good as well. But I think the options you have now medically as being able to go to any doctor and no pre-authorizations, your money is well spent. So good choices on that, sir. Good to talk to you
Thanks,
as well.
Fred.
Yeah, my plan for G was Cigna.
Yeah, good. Yeah, that's very good. That's who I have also.
Yeah, I know.
All righty. All right. Good talking to you, sir. Thank you. Have a good day.
Thank you.
Let's talk to Rob in North Carolina. Rob, can you hear us?
I can hear you loud and clear.
Welcome to Medicare School Daily. What's your questions today, sir?
Hey, Marvin, thanks for having me and what you're doing out there on YouTube. My question is concerning disability and IRMA.
Mm-hmm.
I went on disability back in February of last year, 25.
Mm-hmm.
And after a 43-year aviation career, and I turned 65 last May, and with you all's wonderful help, I applied for Medicare.
Mm-hmm.
And I was a fairly high-income employee up until the end of my employment, which was March 20th of this year. Mm-hmm. And I'm on disability for another year and a little over a year. Mm-hmm. And I'm still making pretty good income on disability, but my question is the IRMA. I have appealed IRMA once for Part B, and I was denied. And I was sort of told, hey, keep appealing. And I just wanted your thoughts on appealing IRMA while I'm on disability, but still at a fairly high income of disability for another year.
So when did you said did you just retire a month ago?
March 20th, he said. Yeah.
I went out on disability.
Okay.
My employment ended March 20th of this year.
Okay.
I went out on disability. I went out on disability over a year ago and stayed an employee for almost a year until they needed to release my head count to grow the department I was in. And we came to agreement that it was time to separate ways, and we did that amicably. So I am fully retired from them, but I am on disability.
Okay.
But I'm paying quite an amount for IRMA, and would like to appeal that.
Okay.
It's eating into my retirement, but
yeah. Okay, so let me ask a couple questions if we can. What was your income approximately in 2024? Because that's what this 2026 premium is be based on.
Yeah, it's around 300,000.
300. Okay, and then in 2026, what do you expect it to be?
It's probably going to be around 2 with the disability. Now, part of it is my supplemental disability, and part of it is the company's disability. It's probably going to still be 250.
250, and then what? I skipped a year. What was 20? What do you think 2025 is, or you
Well,
probably filed your
2025
taxes.
was yeah. When I filed my taxes, it was almost 400 because I was not forced, but I had to sell some stock during that time, so I reported almost 400,000.
Okay, so
for
we
that
got
year. So
300, then 400, then 250.
Yeah, let's talk about the one that got denied. So you say you appealed and they denied it.
And are you filing
That's
individual or do you file joint?
You're married, filing a joint return.
individual. I'm currently single, divorced. Yeah.
Okay, that sounds good. We understand. Alrighty. Well, go ahead. Okay. Well, anything above 205,000 is going to carry that sizable IRMA that you're paying right now. Okay, that IRMA looks like to be what $391 on the B IRMA. So what's going to happen? Yeah, well, 391 is the IRMA, and then you got 202.90. So your total B is looks like about $650 a month. Is that correct? Because that's what we're seeing.
It seems like I'm paying over about $720, $730 maybe.
Yeah, you've got a D IRMA in there as
Part
well,
D
probably
isn't drug,
$75 or something. So the point,
Exactly.
the point is when you made your appeal, what month was that you did that?
Well, I didn't go on Medicare until you all helped me get on Medicare back in, I think, June or July of last year.
Okay, good. So what happened?
July, I think.
Right? Yeah, you didn't really. The reason they denied it is because you did not have a life-changing event. And so here's the issue, though. You could appeal the IRMA, but there's no. They're not going to give it to you. Now you have a life-changing event that happened March 20th, and so but you're still going to be in the IRMA.
Still, if it's over 205 and less than 500,000, you're not going to save any money.
That's right. You have a qualifying life-changing event, but your income didn't go down because of that. So you're going to have to continue to pay the IRMA.
What do you think it'll be next year?
My income next year after disability is probably going to be down to maybe 90 to 100,000 a year as I draw Social Security and from my retirements.
Yeah, so if you can keep it this year, and it'll bump up a little bit next year. If next year you can keep it below 109, it'll probably be maybe 110, 111 next year. That'll be a new chart for 2027. But if you keep it below that, that first threshold, then all of that will drop off.
Exactly right.
But I don't know if you're going to be at 250 this year.
Yeah, you can't. There's no reason to waste your time.
There's nothing that's really, you're not going to be able to do anything.
Yeah, and you don't have to. Just pay your IRMA this year, and then as Josh said, when we roll into 2027, you're going to get a notice in December saying that you're going to have an IRMA because they're looking at 2025, which is 400,000. And so what you're going to do is you're going to appeal. You're going to say work stoppage. And you're going to put in your new numbers. What you just told us, $90,000, or whatever it's going to be, and then you will submit that to the local office or through the SSA.gov system, and you will win that appeal. They'll drop it off.
So this December he'll get that notice.
That's right. He'll get a notice. He'll fill out the SS-44 form. It's an 8-page document. You only have to submit 3 pages. That's it. Yeah. The other 5 pages are all about instructions. And if you need help because you're our client, we're happy to assist with that.
Okay, so the life-changing event is not a reason enough to go ahead and appeal.
It has to be life-changing and reduction of income.
Right. Yeah. Both items. Income has to go down. Now, sometimes it didn't have to go all the way down. We can go down to IRMA levels, but for you're going to eliminate the IRMA totally based upon the numbers you're giving us.
Yeah, and this year is if you're still going to be over 205,000, there's not really much point in you doing anything about it this year other than just regretfully pay the tax.
Yeah, you're not. It truly would be a waste of time to appeal, but next year will not be. Yeah.
Okay, well that makes perfect sense. I mean, if you make it, you pay. That's for sure. But I was just hoping I could eliminate it. But thank you so much for taking my call.
Thanks, Rob.
I appreciate your help.
Appreciate it. Thanks for letting us serve as your broker as well. Take care.
Absolutely. Y'all have a good day. Bye bye.
Take care, Rob.
I'm assuming that disability payments are considered earned income as well. Okay.
Everything is counted if it's going to be reported on there. Because sounds like he's getting Social Security disability as well as private. Yeah.
Boy, it's crazy. There's like 109 to 137, 137 to like it's not moving up very much money, and that chart just goes up so quickly.
Yeah.
So I have just noticed. It feels like we there are way more people that have IRMAs now than there were 10 years ago. Is that because this chart changed, or is it just because in wage inflation and the chart hasn't kept up with it?
Yeah.
I mean, I just feel like it was like used to be, 5%. Now it seems like it's a lot more.
Well, it's probably 20%.
Yeah.
I think they're projecting in 2030, maybe 25% of all people
will be paying
pay
more.
IRMAs. Exactly
Yeah.
right. So, it's because
it's not just
a lot of people have, they make great money.
Yeah. And that chart hasn't probably kept
No,
up proportionally
they
with
adjust
wage
it with
increase.
minor inflation, and
Yeah.
that's it.
Interesting.
Yeah, exactly
Okay.
right.
Okay, let's do another call. Let's get to Yolanda. Lives in, looks like, Louisiana. Yolanda, are you there?
Yes, I'm here.
Hi, welcome to Medicare School Daily. What questions do you have?
Okay, I'm making 65 in September,
Okay.
and I was wondering, I won't retire till 2027, and I'll be 66 when I retire. But I'm confused because my job has medical insurance. I am in medical insurance, but I'm confused because they have A and B. But could I still get A and B with Medicare?
So let's ask a couple of questions real quickly. Is your employer over 20 people?
Yes.
Okay, over 20 people. Do you use an HSA right now, health savings account?
No. I have a retirement. It's teacher retirement.
Okay, sounds good. And then
Are you still working?
Yes.
I think she's-
I will be
Okay,
still
I
working when
thought
I
you
reach
said
the
you-
age of 65.
Okay, just
so
wanted to
you're
make sure.
planning to retire next September 2027?
Yes.
Okay.
Yes.
When you're 66. Okay.
Yeah.
So you're planning on going on Medicare then October of 2027. Would that be pretty close to it?
Could I apply for it then?
Well,
2027?
Oh, absolutely. That's what Josh was trying to figure out. Yeah.
What do you pay for your coverage right now? How much?
Well, it comes out of my check, and for all my coverage, it's like about $400 and something dollars.
That you pay every single month?
Yes.
Okay.
Take it out of my check.
So $400 a month. Let's talk a little bit about that. Is there a deductible?
Yes, I have a deductible of $1,700.
$1,700
When I go,
deductible. And then what is the max out of pocket? I mean, if everything went bad.
What's the most you'd have to spend in a given year?
Well, any given year, I do wellness, but any given year it doesn't. About 2,000.
Yeah, so usually there's like a deductible, which you said was $1,700, and then let's say you had a car accident, got cancer, and broke your leg, and you were in the hospital 3 or 4 times. What's the most you'd have to spend? Is it $2,000?
Yes, 2,000 and
Okay.
2,500.
$2,500. Okay, so you're
She's
paying.
a teacher, has a good plan. One thing we also need to know, in that $400 a month, what all is included in that?
I have a cancer plan in there. Dental is in there. Eye is in there, and my medical.
Okay, very good. We just wanted to make sure on that.
Go ahead.
Okay. Yeah, so I don't think that you're really overpaying right now. Medicare may be a little bit of a better value, but not a whole lot. You really do have a good group plan. It sounds like you're happy with it. Would that be correct?
I'm kind of happy with it because I just had surgery and I still have to come up with $1,700.
Okay. Now, are you single or married?
I'm married, but me and my husband filed separate. He's different.
Oh, you filed.
I'm not on his. I'm on mine.
Okay, and so what was your income in 2025? What'd you make? How much?
33,140.
Okay, 133,140. Okay. All right. We just want to make sure. So what we can do is we can give you kind of a ballpark of what Medicare would cost you. And as we do this, I want you to know you don't have to go on Medicare. In fact, what I would do, I'd either go on Medicare fully or I would just stay on the group plan with your employer. Okay. Don't do both. There's no reason at all to do both. at all. To be a total waste of your money.
Because that's what I was confused about. Because I don't want to be penalized.
Yeah, and
when I do retire.
Yeah, and we don't want you to be penalized either. So what we're going to do is this: we're going to let's do like maybe an N or something, Josh, in that market.
She is 160 and is 115.
115.
You take any expensive medications, or are you pretty?
Yes, I take pressure medicine, stomach pill. Not really nothing that's over the counter.
You mean brand names? No brand names?
No.
Okay.
No.
All generic. Okay. All right. So let's do this. If I were in your position and kind of looking at this as an option, give me a price on a drug plan there, Josh. How much?
Hang on.
Okay. Yeah. And so, again, you're not in a bad position where you are. He's going to look up one more number for us.
There's $0.
Okay, good. So here, if I were, you looking at kind of a good comparison, I think you would, if you did Medicare A and B, you could also do a very good supplemental plan, which is a plan in. And all that combined, including your drug plan, would cost you about $325 a month. $325. Okay, you're paying $400 right now, but that also includes a cancer plan. It also includes dental vision. Okay, so by the time we added a cancer plan in there and dental vision, we're pushing $380, $390. So just around about the same amount. Now here's the difference, though.
But but when I was told when I get ready to retire, the cancer, they're automatically going to pay for my insurance. But they won't pay the cancer. That would be dropped.
Okay. You're saying your employer's going to cover your insurance?
Yes, when I retire. They're going to cover it.
Okay. Okay. Sounds like to me
they're going to cover it.
Okay, fully. Is that until you die?
Yes.
Okay, lifetime. Okay.
Yeah.
Okay, well, I would almost assure you that what's going to happen is they're going to put you on some kind of a Medicare Advantage plan. So you need to find that out. I'll be shocked if they're going to let you stay in original Medicare and they're going to pay for your insurance. I just don't think that's going to happen. They're going to roll you in some type of a Medicare Advantage plan, which may be fine. You may be happy with that. And so, have you ever seen our homepage on our company website before? Have you ever been there before?
No.
Okay, you need to. And here's what I want you to do. Please do this. I want you to go to MedicareSchool.com. MedicareSchool.com. That's our website and a homepage. And you're going to see on the very front page, it's going to say, watch a free workshop. Okay. And Yolanda, you need to watch that workshop. Yeah. It's not very long. It's 50 minutes, but it's going to give you a good explanation of your different options, because I can almost guarantee you when you retire in October, they're going to offer you an Advantage plan, and you may decide you're happy with that, but you need to make sure because there's other plans called supplemental plans that give you more freedom. The Advantage plan is going to put you in a network of doctors, hospitals. It's also going to require that at times you're going to have a pre-authorization, and those plans change every year. Okay, so supplemental plans give you more freedom. Go to almost any doctor you want to, no pre-authorizations, that kind of thing. But you have to decide which one of those systems is going to work for you. Okay, again, half go Advantage, half go sup. So there's no really right or wrong, but you just got to decide what's best for you. Okay, so that's the way it's going to work. So you can stay right where you are now. There's no penalties. Let me tell you what I would suggest doing, though. I would suggest if you stay on your group plan, do enroll in Medicare A only, Medicare Part A. Okay. You do not have to take B. Okay, you don't at all. Okay. So, Josh, add anything that you want to add there. So, Yolanda,
here's one thing I may add is ask your employer for what that plan is going to look like. If they're going to offer you some sort of Advantage plan, get the details on that.
At retirement.
Yeah, get all of that because it may be great, it may be terrible. I don't know.
Yeah.
If it looks terrible, though, I think there's an argument to be made that you could go into Medicare even before you retire, probably end up with a little bit better coverage for the same price.
Right.
Yeah.
But we need to know. And then you can call in. You can call into us. We'd be happy to compare it with you. You can call to someone on our team once you get the details of what that plan is going to be at retirement. Do you have our office phone number?
Yeah, we'll make an honest comparison with you, Yolanda. One more thing I'm going to share. Josh will give you a number. Listen, here's what's important. Okay. Go ahead. Give her the number.
Yeah. I'm going to give you our office number. You got a pen?
Wait, let me get one.
Yeah, grab a pen.
And while you grab that,
Okay. Okay. I got it. Give me
Office
the
phone number is 800-782-6676. 800-782-6676. And you can call with those details, talk to someone on our team, and they can make a comparison and just help you understand. And they'll do a Zoom call with you, right? So you can kind of see the stuff on their screen and all that. Makes it a little bit easier than just the phone. Okay, my dad has one more comment,
just one
and
more
then we
thing.
got to get to our next caller.
I want you to know this. They are not going to cover your Medicare Part B. If they do, I've never heard of it. Okay, so you're saying they're going to cover your insurance, and I would suspect that's going to be an Advantage plan, but you'll still have to enroll in a Medicare Part B when you retire. Not now. We're doing A only now. We're going to do B at a later date, but that B premium right now is $203. And so it'll be probably a little bit more next year, but I guarantee you they're not going to cover that for you. Okay? And again, call us when you're ready. We are happy to help you make that comparison, and we'll be your broker if you want. That's totally up to you. Okay?
Okay. All right.
Thanks.
You.
Take care.
Appreciate the call.
Let's talk to Tim in North Carolina. Tim, can you hear us? Tim.
Yes, I'm here.
Hi, welcome to Medicare School Daily. I understand you have a question about your mother's supplemental plan.
Yes, I sure do. I appreciate you guys, and I watched a lot of your videos.
Well, thank you.
Good.
My mother's facing a bad situation. She's 82 and a widow and lives only on Social Security. She has her own home, but her supplemental insurance plan, she had Combine, and they went out of business a few years ago, and they will not move her or do anything. And she has a plan F, but her premium went up to $557 this last year a month. So that's pretty much unsustainable.
Yep.
So I called the company. They offered us no alternatives or no help. And so I was just basically, we couldn't, the other thing was we couldn't move her because of her health. No one would accept her another company because she has AFib.
Okay, she has AFib. Okay, so let me tell you, I can tell you exactly what I would do if I were in your position. I want you to know, I think F plans are great, but if you can't afford it, you don't stay on it. So what I'm going to recommend,
AFib.
I know she does, yeah. Well, but we can do a chronic SNP. And so what happens is this, really, honestly, up until almost this year, she would have to stay on that plan until later this year, and then we'd go on an Advantage plan. And Advantage plans are going to have a few restrictions, but listen, if you can't afford $557, that's a lot of money. Yeah. So we go on Advantage plan.
We actually tried that.
Tried what?
We tried to put her on another plan, and an insurance agent helped shop around for us, but they all denied her because of pre-existing conditions.
I know that, but they didn't try an Advantage plan. There's no underwriting with Advantage plans, Tim. So they tried to put her on a different supplemental plan. That's not the solution here. The solution is to find an Advantage plan, put her on that plan, and we'll talk more about that. But we're going to see if there's a chronic SNP plan. Heart disease, Josh, there usually is.
Humana Gold Plus diabetes.
All right, sounds good. So here's what I'm going to recommend. We're going to give you our number. I want you to please, Tim, call in because we could still do this for an effective date of 5/1. Okay. Yeah. And so she qualifies for what we call a chronic SNP plan. And the doctor's going to have to verify that she has, this heart issue, which we can do, but we have to do that for this plan to go through. But that way she can get some relief off the 557. Is there any premium on that plan, Josh?
No.
Okay, no premium either. So this is what she needs to do. And if you'll call in, he'll give you the number. And what I want you to do is just ask for an agent. Now, I assume your mom can, she's verbal and all that. There's no problem. Or are you her power of attorney? Or you are doing this for her?
I don't have power of attorney.
Okay, well,
I don't have power of attorney.
Okay, if she can talk, that's all we need to do. And that, you can have she can be on the phone with you. And then one of our agents will explain exactly what you need to do. It's called the Chronic SNP plan. Chronic meaning she has a chronic health condition. SNP is an acronym that stands for Special Needs Plan. And this is an Advantage plan that's designed specifically for someone with a chronic condition. And the beautiful thing is this, we can do this now. Because you have once a year, if you have a chronic condition, you can go on these plans, and this would be a great plan for her, probably long term as well. Zero premium. Now, listen, she's going to have some out of pocket expenses when she goes to the doctor, if she sees a specialist. But again, pay as you go. But it's not right now. What are you? You're paying $1,100. Let's see, you're paying over almost $7,000 a year on this thing. Okay, so the max out of pocket on that is what, Josh? What are we looking at?
Well, there's a United Healthcare one with 5,400.
Okay.
Just trying to see. Yeah, there's two different chronic SNP plans in in her zip code. One's through United Healthcare, one's through Humana. Right. So, and we're going to have to need to look at your doctor, her doctors and stuff to see which one makes most sense.
And everything. And we're not going to make this switch if it's not in her best interest, Tim. But if I were you in her position, that's exactly what I would at least look at. And the agent can take the time. We can't, of course, do that on our program here, but we'll take the time to make sure it will give her the doc coverage she needs, the hospital coverage, and the medications as well. But I want to make sure they do require, I think it's within 30 to 60 days of the plan, the doctor does have to verify that she has the chronic condition. It's a real simple form, but that does have to be completed. And the agent, again, our agent will tell you about that. But that's really all you have to do. And then what will happen is if we get set up today, and by the way, I'm not trying to rush you, just so you know, we can start this June 1, too. It doesn't matter. I'm not really, whatever you all are comfortable with. But the point is, as soon as we know that that's going to go into effect, then you can call the insurance company and cancel that F plan, effective 5/1 or 6/1, whatever agent advises on that. Okay?
Gotcha.
So to me, that's the solution here, sir.
Okay.
Anything else you want to add to that, Josh? Okay.
Yeah. So our office number, let me give that to you, is 800. You got a pen? 800-782-6676. 800-782-6676. Yeah. And I do just want to clarify, like we often, we're probably going to recommend a Medicare supplement plan more often than a Medicare Advantage plan. It's just that, golly, at almost $600 a month, and who knows what it'll be next. Who knows what it'll be, later this year or next year. Yeah. I imagine moving to one of these kind of special plans that's, for either diabetes or heart conditions probably is going to make sense.
I think it makes financial sense as well. I do.
But she's also paying her Part B. So now if you're at $583 plus $202.90, she's spending, and her Social Security check you said was how much?
It's about $1,200.
Yeah, so she's got $400 left. Yeah. So I'm sure you or the other siblings are coming out.
Is that all her income? $1,200? She didn't have any more income than that?
That's it.
Okay. Well, let me tell you what. What I'd be applying for, and you can do this with her. You need to be applying for a couple things. One is called Extra Help, but you can also qualify for, I think, a Medicare Savings Program, which will help offset that Part B premium as well. So you need to be calling Tim. I'd call the North Carolina Medicaid office. And you can apply for it's called a Medicare Savings Program. You can do it through Medicare, Social Security's, the local Medicaid office, because you can probably get some help with her Part B premium as well.
A couple things on that. Does she so I think the limit in North Carolina is $1,816.
Okay,
so she's income? Below that for income.
Is there an asset
resource limit? It's like $10,000.
Okay, does it count the house though?
I doubt it.
Usually doesn't count the house.
Does she have other assets outside?
Any other money?
She has a home and the farm. She has some land. She has.
Is it producing? Is it producing any income right now, or just vacant land?
My brother uses it. Yeah, he grazes cattle and stuff.
But does he pay her?
But not.
Does he pay?
That's something I don't know for sure.
Okay. Well. Okay. So I for some reason I didn't think they counted. Someone's house.
You should call the Medicaid office in North Carolina.
Please do.
Talk about her situation, because you may end up. If she could save get that $202.90, the $203 a month she's paying for Medicare Part B eliminated, right?
Right. Yep.
And then get the $583. She could have an almost $800 a month income swing.
Pay increase. Okay, so call state Medicaid office. Do you have a number for that, Josh?
Yeah, I was going to look up.
Yeah, call this. It doesn't hurt to try. And you may may not go with it, but hey, it's definitely worth the time.
Okay, it's the Medicaid office 800. Wait, pardon me. It's 888-245-0179. 888-245-0179.
Okay,
that's their main.
And just so you know, that would be a separate decision from what you and I talked about. She can still move forward with this chronic SNP plan for sure. It would just be a little bit more attractive on her medications if she qualified for Medicaid. Okay. So, but anyway, and she may not, if they count the house and land against her and all that, but still, we can at least get her this help with this supplemental F premium. That's pretty high.
Yeah, absolutely. It's ridiculously high.
Yes, sir.
Okay. So, I live 3 hours away, so I'll need her on the conversation with the agent.
Yes,
and also the Medicaid office.
I would start with the Medicaid office probably. I mean, I guess you could do them both. But the Medicaid office could also determine what other plans she's eligible for, and there may be a better D-SNP. Than a C-SNP.
Okay, that sounds good.
Yeah.
Okay, good. So, John, my only thing is I don't know how fast they're going to be.
Oh, yeah, that's
true. But, I was just trying to see if we can save that premium for the month of May. But again, that's pretty fast, so it's fine. Yeah, just go ahead.
A long shot.
That might throw her.
But the Medicaid applications sometimes do take some time. I'm just saying to you, she can get on this chronic SNP plan. Save the $557, and then if she does qualify for Medicaid, then we can see if there may be a better plan as well. That's all.
That sounds fantastic.
Okay, Tim.
Appreciate it.
Thanks, Tim.
Sir.
Take care.
Hey, good talking to you, sir. Have a good one.
Thank you. Thank you very much. Love your shows.
Yeah,
thanks.
Thank you.
Okay. That is. What's that? No, that's a really good reason not to go with some fly-by-night insurance company. I don't know. I never heard of it. What did he call it?
Combine.
Combine?
Yeah.
Yeah. So when we generally recommend an insurance company, we're going to go with a big name brand carrier.
Right. Yeah.
Right. Not
it's a
some
regional carrier. Mm-hmm.
I just remember there were always people that were trying to get us to sell Peaking Life, or there was a falconry group that sold a Medicare supplement. It was crazy stuff.
Yeah, right. I know. So
that insurance company went out. Now her coverage didn't change, right?
Oh, well, they have to service that for life.
Yeah, but, for sure. But at the end of the day, the premiums are up. Everyone who's healthy switching off, that's right. And she's stuck because she can't switch off.
It's really, really unfortunate. Yeah, that's why. And it didn't mean to say every regional carrier is bad, but I wouldn't do that. You want to go with a national carrier.
I remember there was a company in, I think it was Missouri, that kept badgering us to sell their plans, and I looked up how many lives they had, and they had 5,000 lives.
Right. Mm-hmm. I know who you're talking about.
Yeah. I mean, 5,000 people on your entire insurance plan.
Right.
And I don't know, it was just crazy. Yeah. And when you've got plans out here that have millions, that you're spreading your risk pool and risk profile across.
That's right.
Guys, join us tomorrow. We're going to be talking about Social Security and whether or not you should take it early, because there's some information coming out from the trustees report about Medicare, or rather Social Security, running out of money. So we're going to talk all about that on tomorrow's show, so make sure you tune in. If you all would like to be a part of the show, the phone number is down there below at the bottom of the screen, 800-824-2004. We would love to chat with you if you need immediate help. We are a team of insurance brokers here at MedicareSchool.com, and we are able to help you sign up for your Advantage plan, your supplemental plan, your drug plan, whatever it is. We would love to help. When you become a client of ours, the thing that's different is you get assigned a dedicated client care manager, and this is someone that you can talk to. When life changes, when life happens, you have someone that's here in the United States that you can talk to, that that's able to help you with anything that comes up. You're not going to call a faceless 800 number that sends you to the other side of the world to somebody that you can't understand. And so just want to throw that out there. We would love to help you. It's no cost for our services. We write in all 50 states, have customers all over the country, and try to do our best. So call us. That phone number is 800-782-6676. We will see you tomorrow talking about taking Social Security early and whether or not that's a good idea.
All right. Thanks.